about the services that are offered through Refresh, through the umbrella, the big parent company of Refresh Mental Health. So some names you might be familiar with, some you may not be, but we're all just here to learn about what our options are, right? That's why we come to events like this. So I'm going to take a moment to introduce Shawna, and then she is going to share her screen, and we've got some information about Refresh Mental Health. So Shawna has been with Outreach and Marketing for Refresh Mental Health's Memphis area program and practices, Fairhaven Treatment Center for Eating Disorders, Mental Health Resources, and the Mid-South Professional Counseling Network for the last year. Her background is colorful compromise of media, marketing, and advertising, especially within the healthcare field. She studied vocal performance and marketing at the University of Central Arkansas. Her primary responsibility and personal mission is simple: to connect people to the care that they need. It's kind of what our Education Day event is all about, connecting people to the care, the information, and the resources that are going to help you. She feels blessed to have this opportunity and to do such meaningful and impactful work in the lives of in your everyday lives. So without further ado, I would like Shawna to take over. Thank you, Shawna, for joining us today. I really appreciate you taking your time out of your Saturday morning to speak with us about the services and the umbrella of care that we can find within your network of providers.
Thank you, Margot. I really appreciate the opportunity. I hope I'm not fuzzy. I live in Midtown, so our internet is real squirrely, but we're going to get through.
You look good.
So, hi, everyone. Thank you so much for attending today and for the opportunity to be here. This is kind of sort of out of the realm of what I normally do, but I'm happy to be here and happy to give y'all some education on some mental health resources that are available to you here in the Western Tennessee area. So I'm going to go ahead and jump in. I don't know that I'm going to take a full 30 minutes. I'm just going to get through it. And then if there are any questions, feel free to pop those in. This can be totally conversational. We're gonna cover quite a few things, but in a condensed way. So anywho, here we go. All right. So I'm Shawna Lei. As Margot mentioned, I'm with Refresh Mental Health in Outreach and Marketing. So essentially what that means is these types of educational opportunities I am typically doing more so with providers, but it's always a pleasure to get to speak to patients and the families and loved ones of them. And so within the realm of Refresh Mental Health, we're going to talk about these 3 different facilities. You'll see the logos all the way through. We'll break down what the situation is with each of them and how it is that you can get connected to them in the case that you ever need any of these services. Oh, let's see. Oh no.
No, there was in the corner a little like advanced arrow instead of using the enter button or the space bar.
Gotcha. Thank you. Okay. Got it. Okay, so today we are going to cover the different levels of care that you can find in the mental health care realm. And we're going to also touch on the Scoff eating disorder pre-screening tool. I will disclose too that I am not a clinician in the mental health field in no way whatsoever. I am a marketer, and this is going to be very top of the tree. So if there are any questions that are more clinically focused, still feel free to send those my way. If I cannot answer it, or we do need a more official clinical response, I'm happy to get you an answer at a later date. So anywho, top of the trees, we're gonna tap on the 5 questions that can help pre-screen for an eating disorder. And then we're gonna watch a quick little video on the 9 truths of eating disorders. And then we'll go over each of those facilities that we've mentioned and get you the contact information on how it is that you can get involved. So diving into the levels of care that you can find in mental health, there are 5. So the way that we're going to look at this today is going to be from the most extreme to the least extreme, right? So acute inpatient is definitely going to be where we start, and we'll work our way down all the way out to outpatient counseling. So with acute inpatient, you might most familiarly understand this level of care as Lakeside, Crestwind, Parkwood, etc. So essentially what that means, it is the highest intensity of medical and nursing services provided within both a hospital environment as well as a skilled nursing facility. So that is 24/7 care in a hospital type setting. And meaning, of course, that there will be full and immediate access to ancillary care, especially in the case that it is separated from a hospital, that the facility itself is separate from a hospital. So taking a step down, we're looking at a residential level of care, which you're going to most commonly find when it comes to mental health, general mental health, in terms of diagnoses such as anxiety, depression, psychoaffective disorders, so on and so forth, eating disorders, and substance abuse. So this level of care, again, it's exactly what it sounds like. It is 24-hour care. There will be counselors stocked up, available. It is a much smaller milieu than an acute inpatient milieu. And group treatment is typically one thing that is really heavy in a residential setting, in addition to those individual therapy sessions and whatnot. So it provides quite a bit of support, especially if someone is stepping down from that acute inpatient level. It's just a really good way to solidify your surroundings and your place in recovery, and of course, have as many resources as needed in this 24/7 environment that is typically homey. They typically feel like home, or are located in what was a home built for a family. So stepping down one more, you might hear this level of care, partial hospitalization program, referred to as PHP. And so what that means is it's going to be 5 to 7 days a week, 6 to 10 hours a day. So it could be referred to as a day hospital or day treatment. It is still, as you can see by the amount of days and amount of hours, quite a bit of programming, but the biggest difference between the PHP level of care and the residential level of care is that patients can typically live at home when they're not programming for those hours a day, so they can get back to work or school, whatever it is that they are held responsible for in their own lives. And so Fairhaven, for instance, this mentions right here the supportive housing options for individuals who don't live near the clinic. With Fairhaven, we do offer transitional living. We'll get into more of that, but that is extremely beneficial even for local clients who do need that extra level of support, but are therapeutically processing and progressing through the program and through their recovery. If they do need that additional sense of support and being surrounded with those who are like-minded and going through the same type of program, then transitional living or supportive housing. It might also be considered silver living in the substance abuse world. Those are typically going to be found for PHP programs, that housing component. And then taking one more step down before we get to outpatient, we're looking at what we in the field call IOP, or intensive outpatient program. So this is definitely a much smaller and less intensive level than PHP. As you can see, it meets typically 2 to 3 days a week for 3 to 5 hours a day. And so again, with the group therapy being really prominent here in residential, in PHP, and now IOP, typically you're going to see more group therapy happening at the IOP level than you would necessarily at the PHP level, because you're starting to turn the tide in terms of the balance between the individual work and then the group work. So at this level of care, as well as the PHP level of care, patients are typically as medically stable as possible regarding their particular mental diagnosis, right? And they don't necessarily have to require medical monitoring. again, it is an outpatient program. So this is, you can still absolutely live at home and program fully at the IOP level, and continue, in the case that medical monitoring was needed, for other co-occurring conditions. Of course, this level of care makes all of that possible to play in both spaces. So we, typically expect that clients in this level of care are psychiatrically stable and do have sufficient control in social situations, educational situations, so on and so forth. As I mentioned, the purpose for that too is really as you turn that tide and start really focusing on and placing these individuals in the groups that are most appropriate for them. Of course, they have to, play in the sandbox, right, with others who are in the group. So that is IOP. And then here we are to outpatient therapy. Outpatient therapy is going to look like a lot, but in general, we're going to break it down in terms of what it is that you kind of sort of think outpatient therapy might look like versus the ins and outs of what it could actually look like for various different reasons of people needing different types of care. So first things first, individual psychotherapy is definitely going to be that first bullet point that you typically think of when you're thinking of a therapy session, right? So therapy, of course, offers a broad treatment for a range of issues. Therapists can, work with you with coping mechanisms and lifestyle changings and helping process challenging emotions. Definitely help turn the tides when it comes to self-defeating thoughts and behaviors, and definitely help you find a place where you can be more mindful in the ways in which you are struggling and the ways in which you hope to grow. And family counseling is very much along the same lines of that individual psychotherapy, but of course you bring in the family instead of just the individual. And so this is typically something that I'll also say this: outpatient therapy can look like a blend of any and all of these things also. And so one of the big benefits with family counseling is that you really get to see the dynamics that can contribute to addiction or perhaps eating disorder behaviors or self-defeating thoughts and behaviors, so on and so forth. So it's really interesting to get to see the family unit after, individual work has been done in terms of, really ensuring that the work that is being done with that individual is also being equally supported by the family as well. So moving on to group counseling, and we'll dig into this a little bit more. So it's typically going to be groups of people with similar issues. And so it would be group counseling is typically led by a licensed professional counselor, perhaps a social worker, so on and so forth. And they will typically stay close to people who are in similar situations as you. So you're not necessarily going to find, let's say, you're not necessarily going to find someone who's struggling with anorexia in a substance abuse group, right? Unless that is additionally appropriate for them. They would definitely be more focused on the anorexia type groups instead. So there is a difference too between the group counseling and then support groups. So support groups are very distinct from therapy. So instead of having that licensed professional counselor or licensed clinical social worker, it's more so what you would picture AA to look like, right? So fellowship support, you can seek guidance, sponsorship, things like that from people who have been in your shoes before. And then lastly, medication management, which this is something that's provided at every level of care in the mental health world. But on the outpatient level, you might have just a single psychiatrist, right, in your book of doctors that you regularly see. So medication management, for those who don't know, is just the process of assessing psychiatric medications, their ongoing effects, side effects, what have you. It may also mean that they are looking to blend different medication. Just really take a really close look at other medications that you might be on to find some safe alternatives, and keep everyone who needs psychiatric medication as stable as possible. So switching gears a little bit, we're gonna take a moment and watch this video. So this video came from, please move this window. This movie came, oh no. Resume share.
Truth number one, many people with eating disorders look healthy, yet may be extremely ill.
Truth number two, families are not to blame and can be the patients' and providers' best allies in treatment.
Well,
Truth number three, an eating disorder.
it seems that we cannot watch the video. I'm unsure if you all could hear the video. Regardless, we will move right along. My apologies about that. So looking at eating disorders, just because it is the primary of the practices that I do represent, it is very important that we talk about it and just provide a touch of education around eating disorders as a whole. And one of the simplest ways that we can do that is by taking a look at the Scoff Questionnaire. And so what it is that we're looking at here is, this was developed by a psychiatrist back in the 80s, actually. And we typically use this when we are communicating with both clients, patients, their family members, and also perhaps their physicians when it comes to just a general overview or checkup, if you will. So those questions look like, this is called the Scoff Questionnaire, and you can see here I've bolded out the S, C, O, F, and F. And so what it is that we're looking at here is, do you make yourself sick or induce vomiting because you feel uncomfortably full? Do you worry that you have lost control over how much you eat? Have you lost recently more than 1 stone or 14 pounds in a 3-month period? Do you think you are too fat even though others say that you're too thin? And would you say that food dominates your life? So if the way that this scale works is if you answer yes to 2 or more of these things, we are seeing 100% sensitivity for a likely case of anorexia nervosa or bulimia nervosa. Without diving all the way off the deep end, just to touch on the 2, anorexia and bulimia. Anorexia is what we would essentially summarize as the extreme restriction of caloric intake, whereas bulimia would be the purging of caloric intake. So that could look like inducing vomiting, that could look like abusing laxatives as well. And with bulimia, typically it is, there's a common misconception that binge eating prior to the purging behaviors is required. However, it is very possible to both restrict in anorexic type behaviors as well as purging with bulimic behaviors. And so anywho, we say all of this to say that in the case that you or your loved one can answer yes to 2 or more of these, a further assessment with an eating disorder specialist is certainly recommended. So to you providers out there too, who are on this call, let's talk about getting this added to your intake process too. So switching gears into Refresh Mental Health and really talking about the resources that are available to you here in Tennessee under the Refresh Mental Health umbrella, we're going to dive in at the top and then work our way down. So Refresh Mental Health is the parent company of multiple mental health practices across the country with unique and specialized programs. We offer comprehensive services related to mental health, eating disorders, relationships, substance abuse, addiction treatment. Different levels of care that we offer at this time are residential, PHP, IOP, outpatient, and in-home care. Services we offer are available for children, adolescents, adults, couples, families, groups, psychiatry, management, all the things. Psychological and neuropsychological testing is also available under the Refresh Mental Health umbrella. Depression and anxiety is going to be a recurring theme that you see in all of our practices for the most part. And then too, looking at those mental health programs, we do also offer TMS at certain facilities. None of the ones here in Memphis though. So touching back on the eating disorder facility, Fairhaven Treatment Center is here in Memphis, Tennessee. So we offer residential, we'll get to that, but it is a residential and outpatient treatment center that offers the opportunity for full recovery from eating disorders. And our facility is absolutely gorgeous. It's very tranquil. It's very therapeutic. It's very zen. And we use evidence-based therapy for eating disorder symptoms and co-occurring problems such as anxiety, depression, OCD, other challenges that contribute to and perpetuate the eating disorder. So again, we touched on anorexia and bulimia. We sort of tapped on binge eating. And then OSFED is other specified feeding and eating disorders. And then co-occurring conditions that Fairhaven is specialized in treating in addition to the eating disorder as a primary is trauma and attachment disorders. So the levels of care that we offer at Fairhaven for women, adult women ages 18 and up are residential PHP and IOP, and there's that transitional living component available as well. And then for the IOP program, that intensive outpatient, we do offer day and evening programs for those who are getting fully back into the swing of things at work and at home and in life. So for our adolescents here in the Memphis area, we offer PHP and intensive outpatient again for girls ages 12 and up. We do also work with the transgender population really closely. We are certainly an LGBTQIA+ informed and allied staff across the board at Fairhaven and the other practices. So in the case that that is applicable to you or a loved one, do not let just the women and girls piece stray you away from seeking help if you need it. So moving on to mental health resources, we also might refer to this practice as MHR. They house mental health and substance abuse IOP program. The treatment team provides group, individual, family counseling, as well as medication management. So we do have a psychiatrist on staff for the IOP level of care. So what this looks like on a day-to-day is 3 hours of group therapy a day, 3 to 5 days a week for about 6 weeks. So day and evening programs are available as well here at MHR. And the treatment goals that we have here are identifying and coping with relationship problems, trauma, role transitions, grief, loss, obviously problem-solving skills, and work-related stress, as well as living life with a diagnosis or being part of the support system of someone with a diagnosis of Huntington's. Our substance abuse track addresses addiction and recovery, and we aim to meet everyone where they are in their stage of recovery. So the professional services, again, that individual and group therapy, family and couples therapy, and then med management. So when it comes to those groups that we talked about, the group therapies that are available at the IOP level of care for MHR are as follows: parenting and families and spouses of substance abusers, grief, trauma, and anxiety. And then taking one more step down in terms of level of care, as well as practices that I represent, we're looking at Mid-South Professional Counseling. So MPC, as we'll call it, is the routine outpatient line of mental health resources. So you have MHR at the IOP level, and then you have MPC at the outpatient level. So we strive to offer high quality professional service, of course. So again, with the evidence-based therapy approaches and research also backing up the quality of the relationship with the therapist, as well as the most appropriate types of therapeutic modalities that would best suit the client's needs. So it is definitely the relationship with your outpatient therapist is certainly, it should encourage ongoing feedback so that you can really get the most out of your time with your therapist. And again, with the pride that we are LGBTQIA affirmed and allied, as well as diverse in as many ways as possible. We definitely work at all levels of care and in all of our facilities to ensure that we provide the most appropriate fit to help clients and patients meet their goals based upon their worldviews and values, whatever that may look like. And in the case that we don't have the right fit, you can call me and I will find you the right fit. So the outpatient services at Mid-South Professional Counseling look like so: individual and family, couples, child and teen, anxiety, depression, mood issues, trauma counseling, chronic pain counseling is also its own program, addiction and substance abuse, as well as grief. So this is my contact information. In the case that anyone here is interested in learning more about any of these programs, has any questions regarding anything that we talked about today, or is interested in an assessment in any way, please feel free to take a photo of your screen with your phone. And we can also, I'm sure Margot probably get this sent out to them in the case that they need to reach me. You can call me directly for any of the facilities we discussed today, and I can help get the intake process and Q&A also started as well. So that's all I've got today.
Shawna, what insurance, because that can always be a driving factor in terms of where people seek and find treatment. What insurance do you guys accept?
Yes. So for Fairhaven Treatment Center for Eating Disorders, we do have contracts with all commercial insurance companies, with the exception of United. Again, call me. If we can't cover it, we can find someone who can. And Tennessee Medicaid is also accepted at Fairhaven Treatment Center, as well as TRICARE. For MHR and MPC, that is the most major insurances. At this time, we do not work with Medicaid or Medicare at any of our MHR or MPC locations.
Mm-hmm. And it said in your presentation that you have psychiatry services. Was that just for IOP, or is that available through outpatient as well?
So if a client starts with us on the MHR side of things at the IOP level, and they do not have a psychiatrist already when they're at that level with us, then we will offer those services, of course, to them at the IOP level. Now, in the case that they go from the IOP level to the outpatient level with us, and they still don't have a psychiatrist separate, because of course their care team may be consisted of pre-existing, physicians and clinicians, then they can continue on at the outpatient services with our psychiatrist.
But at the outpatient level, is there med management?
No,
without
not without that step down from IOP. Now, we can certainly make the connection to an outpatient psychiatrist at the outpatient level.
I see. Okay. That's what I was wondering. I was like, oh, psychiatry services, because they can be hard to come by.
Indeed. And that's because of that's why we have to, keep it the way that we do, because otherwise, I can't imagine carrying the caseload that would exist.
A lot of people who are in need of health, behavioral health care, and mental health needs. Questions, concerns for Shawna that we would like to address? Feel free to use the chat. Feel free to ask her directly.
Let's see. Am I seeing?
No, I put your name and phone number in the chat. Awesome. What's the current wait time to get into partial IOP or even just traditional outpatient? How long does
Yes.
it take to see somebody?
So in terms of, I'm going to go Fairhaven and then I'm going to go MHR MPC. With Fairhaven, when we're looking at eating disorders as a whole, we are typically, from the time that you contact us to the time that you're scheduling an assessment, ideally is no more than 3 days that your assessment is happening. From initial inquiry to full-on assessment. Once an assessment has happened for us at Fairhaven, we do require that our director of nutrition, our director of clinical operations, and our nurse manager all sign off. And that's taking a look at medical clearance as a whole. So we're looking at labs, very recent labs. We're looking at EKGs in certain circumstances. We're covering all the bases. And so that admissions process with insurance verification and all the things that come along with getting someone admitted into an eating disorder program as a whole, regardless of the level of care, is typically going to be about 10 days from the time that that process starts to the time that you're starting programming in the eating disorder world. Now, looking at the IOP level of care that we provide at MHR and the outpatient level of care, of course, it is depending on schedule with the outpatient level of care of the therapist that you are trying to work with. But from the time that you contact us to the time that you have completed the intake process, that's typically about 48 hours with MHR and MPC, IOP and outpatient.
Wow, you could see somebody in 2 days. That's pretty impressive.
Thankfully, we have grown. We have 3 Memphis area locations. So we're in East Memphis, Bartlett, and Germantown. And so with that, and with COVID, we've been able to get some therapists on like a part-time basis who are seeing people virtually, and it has definitely helped speed up that process. So for now too, let's see.
Do your facilities have much experience dealing with dementia?
I will tell you from an eating disorder standpoint, I would feel confident that with the exception of Denver Acute, which is an acute inpatient, it's the only eating disorder specialized acute inpatient hospital in the country. Aside from them, and they are not related to us, but we are very closely partnered with them, I would not in eating disorder world expect any facility to be able to say yes to experience with dementia patients. However, in the MHR side of things, we do definitely market that we can and do work with clients and patients who are ages 9 to 99. And so in the case that that is a situation for you, I'm confident that we could find a clinician on the MHR MPC side of the world, on the mental health side of the practices that I represent, who does have experience with those patients. Yes.
Okay. Yeah, your name and phone numbers in our chat. They could take that down and call you with more specific questions or how to get linked with that. Yeah, absolutely. So about 2 days to see somebody in practice, and it's nice to hear that you're seeing people virtually.
Yes.
That's helpful because not everybody's feeling comfortable leaving their home. So that's amazing that you have virtual offerings. Anyone else have questions, concerns, things that they'd want to address, clarification on anything? I guess the other question that I had is where can you access? If we take Fairhaven and the eating disorder side out, but just looking at the behavioral health side, how do you access? Like where can you enter in that continuity of care? Can you enter at any point? Do you need to start at the bottom and work your way up? Do you start from the top and work your way down? Like, where do you start?
So that's all going to be determined during an assessment or during the initial intake conversation. In the case that someone is stepping down from a higher level of care than IOP, then of course, IOP is probably going to, if they're coming from a PHP to MHR, chances are they're going to be an IOP. Now, it is possible to start most anywhere in the hierarchy, right, of levels of care. But it literally is determined case by case, assessment by assessment, and it is determined, in that initial conversation where the most appropriate starting point is.
Mm-hmm. Okay. Anyone else have additional questions, concerns?
All right.
Wonderful. Well, thank you so much for spending some time with us on your Saturday morning. We've
Yes.
appreciated learning more about the offerings of Fairhaven MHR and MPC, because sometimes it all just kind of sounds like, like alphabet soup, all of
Right.
those letters and acronyms coming at you. So some clarification around what they are, what they look like, and how to access them, I think is always very helpful.
Thank you. Thank you for having me. And if anyone needs anything, feel free to text the phone number that you saw today. And yeah, I'm happy to help connect anybody as best as I can.
Beautiful. Thank you. Thank you. Thank you.
Bye-bye.
We'll be in touch.
Uh-huh.
All right. We have Dr. Ledoux starting at 11:30. So if we want to come off chat and talk with each other or use the chat feature, we are welcome to